Good morning and welcome to Ask Dr. Murphy, this week in public health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, August 14th, and we welcome any questions or comments down below or at any of our social media linked in the description. As a reminder, you can get Dr. Murphy's resources sent straight to your inbox for free on his Substack, which you'll find in the description. Starting today with another update on cyclospora and some more news surrounding Taylor Farms. Dr. Murphy, can you bring us the latest?
Yeah, well, this thing's not going away. Probably a little bit of slowdown in new cases, but it's still up there. So 24,000 cases and more Taylor Farms recalls. So of these 24,000 cases, 740 have ended up in the hospital. 2 people have died in Michigan, reported from Michigan. And 47 states, basically it's everywhere, and territories. And the hardest hit state was Michigan with 13,909. What happened with Taylor Farms is not only were they associated with that iceberg lettuce problem with the cyclospora, but they have a salmonella problem with their jalapeno peppers, both fresh and contained in certain salsas and guacamole, sold at Walmart and Whole Foods. There's the whole spectrum there. The distributor, Coast Citrus, has also recalled the Taylor Farms supply to Chipotle and Qdoba stores, restaurants. So it's like, wow, this is out there. This is tragic. So surveillance is important. And I hope they don't continue to decrease surveillance. Cyclospora in particular was taken off the mandatory surveillance list just before this outbreak. Maybe they'll rethink that.
Yes, maybe they'll rethink that. And it's worth noting that that salmonella outbreak is actually an outbreak. Over 300 cases of people who have been sickened by salmonella across 27 states. So again, we will keep our eye on that as we have for cyclospora. But some really great news mixed in with some interesting facts is that Tamiflu, the drug antiviral for the flu, continues to be extremely effective for children. Can you tell us about it?
Yeah, so this is a study published this week in JAMA Pediatrics, very reputable journal. And it showed that Tamiflu, which is one of the older drugs approved for flu, reduced ICU care by 31%. The interesting thing is that at the same time, I mean, we knew this worked, but here's some hard data. The number of children being treated with Tamiflu who are in the hospital dropped from 86% to 63%. Like, they're not even, a lot of places are not even giving Tamiflu. So this is an important reminder. Come in with the flu, you end up in the hospital, get Tamiflu. It really does work. And not only does it prevent about a third of the ICU admissions, but the kids that took Tamiflu had shorter hospital stays.
Yes, so really great news there. And like
Mhm.
you said, a great reminder to continue
Mhm.
using
Mhm.
Tamiflu.
Mhm.
Now, the measles, we're on this 35-year high. Can you tell us about the cases? And also, there's been a big story regarding the measles vaccines. Can you bring it
Yeah.
all to us?
Yeah. So we're up to 2,566 measles cases this outbreak. Um, this is, you know, basically a catastrophe. And we've, it's just continuing. So Pennsylvania is the site of the most recent big outbreak. They've had 258 cases confirmed now. And, you know, keep in mind, we had 0 cases in the year 2000 when the vaccination rate was higher. Now, on top of everything else, the vaccine for measles is actually a vaccine for three different diseases: measles, mumps, and rubella, that the old German measles. They've been together in the same shot since 1971. You can't even get those vaccines individually because they don't exist in the United States. The vaccine was developed first in 1963. And then the other two came on like in 65 and 67. And then in 71, they put them all together. Billions of doses have been given. I mean, there is so much safety information on this on this vaccine. I don't think you can have more information about anything. This much information. So the president signed an executive order to split the vaccines into three and to give them individually on different days. And that is no expert in the field. The Academy of Pediatrics and Infectious Disease Society and all these professional groups, they think this is like a really bad idea. The reason is not only is it inconvenient and more expensive, and it doesn't even exist, but what happens from the public health side is that a person may come in once, but if now they have to have two more visits to get the same treatment, you drop off numbers of people. They're just not, some people are just not going to come in. Combining therapies like this, preventive therapies like this has always been preferred, and it works. You get more kids or people, whatever you're giving, covered if you can give it all at once. So if they actually do this and split this, get the old vaccines approved again, and they actually do this, many children will get either measles, mumps, or rubella, depending on which one they didn't get. And that's going to result in more hospitalizations and even deaths. You can die from these diseases. So that is kind of where we stand with that. Now, of note, the new director of the CDC, Dr. Erica Schwartz, was approved by the Senate. Seems like a very reasonable person. And it's the CDC who makes the recommendations for the vaccines, not the president, by the way. It's the CDC. So it's going to be interesting to see what she does because Susan Monaretz, the last director of the CDC, didn't go along with what Secretary Kennedy wanted to do, and she was fired after 1 month on the job. So, Erica, hang in there. We're behind you. We'll see what happens.
Yes, that is a big developing story that we will be following as it goes along. And like you said, because those vaccines are not approved separately, there would be a long period of time that drug companies would need to formulate and test and get those approved. So we will see all that comes up with that.
Yeah,
But
and
our final,
there's another reason why they probably don't want to do that is because the next administration is going to throw that executive order into the garbage can where it belongs. And so then they're going to have these vaccines that nobody wants to give individually. So it's just a craziness right now.
precisely. And our final story today is one that we haven't talked about in a long time.
Mhm.
But in Louisiana, there are some very serious cases of vibrio. Can you tell us
Mhm.
what it is and what these cases have been?
Yeah, this is nothing new. This happens every year. This vibrio vulnificus is this bacteria that is in salt water, particularly when it's warm, so the summertime. So like oysters, anything in this like brackish water, it can be there. And particularly if people have underlying health conditions, it can be quite serious. So they've reported from Louisiana, 5 people have died this year from Vibrio vulnificus. And 9 people in the state all told have become infected. So it can be a very devastating infection, particularly if you have an underlying immune disease. Anybody with liver disease, cancer, diabetes, HIV, thalassemia, any immunosuppressive therapy, all these people are all very much at high risk. So It's just another note of things you have to be careful of.
Absolutely. And while it is rare, it is a great reminder to avoid these coastal waters if you have open wounds as well.
Mhm.
But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing us all that is happening this week in public health.
Well, great. Thank you, Katie. Have a good weekend.
Thank you. And thank you all for joining us for this week's installment. We hope to see you back next week. And as always, questions or comments are welcome down below. Have a nice weekend.